All right, we're going to get on now Dr. Jeffrey Klausner. He's an epidemiologist at UCLA. And he's also a friend of mine, and we've had Dr. Klausner on the show before. He did an interview with a San Francisco TV station, Channel 2, KTVU, on Saturday, and I came across it, and it was quite a different viewpoint than you've been hearing from a lot of the experts. He thinks the state government here is using a sledgehammer instead of a targeted approach to the coronavirus clusters in the state, and that the current lockdown we have in California is too harsh. And we're going to get Dr. Klausner on here. How are you? Welcome. Wait a second. Let me do this again. There we go. Now you're on the air.
All right. Good afternoon, John.
Good afternoon. Well, talk in detail about your idea that this is a sledgehammer approach and it's overkill.
Sure. So, I've been studying the epidemics in every country since early January. My team at UCLA has been looking at the epidemic patterns in Wuhan and Japan, South Korea, Taiwan, Singapore, Northern California, Santa Clara, Europe. And, one thing we consistently see, the epidemics go up and the epidemics go down. So that's one key point. The second key point is we see highly localized spread, but no general spread. So while there was severe epidemic, obviously, lots of deaths in Wuhan and central China, there were no epidemics in Beijing, in Shanghai, in Guangdong. In South Korea, there was, localized epidemic associated with the church and the attendees to that church and family members and other contacts, but there was no generalized spread in the larger population, nothing really in Seoul. So that tells me that there are certain conditions that have to exist for the epidemics really to take off. So it's like building a fire in the woods. You can have the tinder, the kindling, but if the wood is wet or if the wind is the wrong direction, it doesn't matter how many matches you throw on that, it's not going to take off. So other scientists have shown that those conditions are, physical proximity. There's got to be a population density. There's got to be certain temperature and humidity conditions outside. And there's got to be, a certain close type of personal behavior where people are hugging, shaking hands, and kissing. And those exact conditions we saw in northern Italy, in the Lombardy region. So the virus gets into that population, spreads very quickly. Lombardy has one of the oldest populations in terms of age in the world, first oldest being Japan. So very highly vulnerable population, and there's devastation there. But that's unique to these localized places. So like California, for example, very different. We actually have not had any real epidemic spread. We've had outbreaks. We've had some clusters. But if you look at the map of California by county, we have a few hundred cases here in Los Angeles County, a county of 10 million people. So what I'm asking our public health and political leaders to do is to start rethinking our approach, that through the traditional methods of awareness, personal behavior change, testing, treatment, and isolation of individuals, we can actually have a more strategic and much, much less harmful response.
What would that look like if you were in charge? How would you construct it?
Well, certainly, we should have invested earlier in the development and expansion of laboratory tests, but we can't go back in time. But there's still opportunity to further enhance our laboratory capacity. I'm working with a brand new laboratory that we were able to obtain space in San Dimas. And basically that drug testing laboratory has moved all its current drug testing machines out, and we've built a brand new COVID-19 testing laboratory that currently is doing 1,000 tests a day, and by the end of the week or Monday we'll get up to 10,000 tests a day. So we need to replicate these high-volume, high-throughput labs around the state and around the country and make sure that everyone has access to laboratory testing, that we can get first responders, fire, EMS, police back to work quickly if they're exposed. We can get patients who are presenting to clinics and hospitals tested quickly and properly identified. So that's the first principle of infectious disease control. is case finding. And then what you do with those cases depends on what tools you have, so we can isolate them. And then also now we have very exciting new treatments that will soon be widely available, and they are increasingly available through specific protocols.
Is there a way to get the people who are at low risk? Just let's talk generally and say everybody under 50 is at a very low risk of dying from this, and get them to work and get them to school and somehow protect the people who are elderly and or physically compromised?
Yes, I think we can protect the vulnerable. I think we can protect the elderly. I think, we know that elderly often live in residential facilities and, different kind of nursing home or assisted living. So, those individuals should certainly be, protected, and staff who are working there should be screened, and people should be monitored in those settings for any fever or early signs of any illness. And then, the people in the schools and the people in work in general, they can go about their, regular activities. But now with the awareness, if they develop any symptoms, and this has already happened, people develop symptoms, they don't go to work or school. And they get isolated and they get tested to see if they have infection or not. So I think we can have a much more strategic plan in place and actually get California and potentially even America back to work and back to school.
And could that be... Go ahead.
The impression that we get when we follow this from the health experts that we see on TV all the time at these news conferences is that they don't want more of these large epidemic clusters that you described around the world to happen here. But you're making it sound like conditions aren't so for that to happen because they're worried about the healthcare system being overwhelmed with so many people in dire straits. Too many people die needlessly.
Right, but I think a lot of those, dire predictions are based on some false assumptions, including that everyone is going to get infected at the same time in the country and that all these ICUs will be impacted at the same time forever, when the reality is that, we saw this cluster in Seattle in the nursing home. That was tragic, right? There's 2 or 3 dozen people died in that nursing home. Families of workers and workers themselves got infected. But Seattle now does not really have any continued epidemic, and there's very few continued cases in Washington State. We had cases in Santa Clara from the returned cruise ship travelers and people who were traveling outside the United States. That's essentially burned its way out now. We don't have a epidemic increase. So, yes, there has been an increase in 3 boroughs in New York City, and some of those borough hospitals have been heavily impacted by people coming into emergency rooms and hospital beds. But we actually have some reserve and capacity in our systems. When I used to be a resident at Bellevue Hospital in New York City in the late 1980s, it was common that, ambulances would go from one hospital to the next. They would know which hospital had available space, and there was a very sophisticated diversion program. And through the entire city, you could have people go to different hospitals where space was available.
If you were running things, how quickly would you get at least people under 50 back to work? Is this something that ought to be done soon before we have irreversible damage to the economy? Is it practical to do it soon?
So, I think at this point, we have to finish this week on this social isolation. I think it would be too disruptive this week to send people back to work and school. But I think it's highly realistic by the end of this month, by March 31st, it can be over in terms of the isolation, and April 1st, we can get people back to work and get people back to school. Every day we increase our laboratory testing capacity. Every day we have more evidence of the benefit of the treatment protocols. And every day we see the absence of generalized spread in much of the country. So where there is active epidemic activity, it might make sense to extend periods of isolation there a little bit longer. So maybe in some boroughs in Manhattan boroughs in New York City, but be localized. So don't shut down the entire state of New York. There's very few cases in most counties in New York State. In California state, there's very few cases in most counties. It makes no sense to shut down the entire state of California when the epidemic is highly localized.
Well, the headlines are always, though, about all the new cases. It's all about the numbers. And every day, the number of new cases grow. And in L.A. County, we went from 2 deaths to 5 deaths in a matter of days. This is what's got people in this frenzy.
No, there's no doubt that the media has been misinterpreting data. They've been reporting what we call numerators or cases without thinking about the population at risk, which when we divide the number of cases over the denominator, we actually have then a rate. And the rate, the number per 100,000 population, is actually quite low. In most counties, it's less than 1 per 100,000. So that's a very, very low rate of infection, and in general would not be concerning to public health officials. But because we've just been focusing on the numerators, as you say, 2 deaths doubles to 5 deaths, doubles to 10 deaths, that is what's getting people concerned. So I think the media and our access, so this is unprecedented in 2020, is that every single human in America has a device in their hand that every minute they're looking at and seeing new news blasts and new updates and new information. And the effort for these commercial information services to, get the eyeballs on the iPhone has, completely fueled the panic and fueled this pandemic of panic in America.
All right, Dr. Jeffrey Klausner, quite a voice of reason. I'm glad you came on with us. Thank you very much.
Thank you for inviting me.
All right, Dr. Klausner.
UCLA epidemiology is a specialty, and you heard it. We're going to talk more about that when we come back.